October is Breast Cancer Awareness Month. I had the opportunity to chat with Dr. Christina Jacobs, a radiologist and breast imaging director at Bronson Healthcare, about the importance of getting a mammogram. So, doctor, what is a mammogram?
Well, Paul, a mammogram is basically an X-ray of the breast tissue. Unlike X-rays of other body parts, it requires that the tissue be compressed between two plates. The compression holds the tissue still and decreases the thickness so that we can get a greater detailed image and use less radiation.
So does that compression hurt?
Well, it can be uncomfortable for the brief amount of time that the breast is in compression. It's pretty uncommon, but some women do feel pain, and actually fear of pain or having had pain with a prior mammogram is the number one reason that women avoid getting a mammogram. We can help with that. A woman who's concerned about pain should tell the technologist at the start of the exam, and the technologist will work with her to make it as comfortable as possible.
Yeah, some of your locations have a new innovative compression paddle.
The Smart Curve paddle. This paddle is curved, similar to the breast contour rather than flat, and so it can distribute the pressure more evenly. We've been getting a lot of good feedback on how big of a difference that actually makes.
Any other advice for women concerned about pain during a mammogram?
Well, there are a few other things that can help. If a woman is still menstruating, she should schedule the exam for the week after her menstrual period when the breast tissue tends to be the least tender. It can help to wear a comfortable bra without an underwire on the day of the mammogram. Taking an over-the-counter pain medication such as aspirin or ibuprofen about half an hour to an hour before the exam has been helpful for some women. We also find that anxiety over the exam is associated with greater discomfort or even pain. So we do encourage a woman who has these concerns to bring a support person, a friend or a relative, or to plan something fun to do afterwards that helps focus her mind on the reward to look forward to rather than the anxiety of having the test.
Why are screening mammograms important?
Studies from multiple countries have proven that regular mammogram screening saves lives. The goal of a screening mammogram is to find breast cancer early before a woman has any symptoms. Breast cancer can be beaten when found early thanks to great treatments we now have available. And the best chance of finding a breast cancer early and effectively treating it is through screening mammograms.
Now, there are different guidelines for screening. What does Bronson recommend?
You're right, Paul. There are different guidelines, and that can be rather confusing for women as well as for their providers. What's important to know is that studies show, and all of the guidelines agree, that yearly screening starting at age 40 saves the greatest number of lives. Our breast health experts at Bronson believe the benefit of saving a life by finding a cancer early far outweighs any potential risk of a mammogram, and that's why Bronson recommends yearly mammogram screening starting at age 40 for most women.
Now, doctor, if a woman is diagnosed with breast cancer, what are the services that Bronson offers?
Well, at Bronson, we have a comprehensive breast health program to help patients diagnosed with breast cancer. All patients are assigned to a Bronson breast health nurse navigator who will help guide her through her treatment and selection of a surgeon if needed. Bronson has specialists in breast surgery, including Dr. Micah Reschke with Bronson Breast Surgery Specialists in Kalamazoo, and Dr. Carrie Murray with Bronson General Surgery Specialists in Battle Creek. At Bronson, we have 4 breast health nurse navigators that see patients at all our Bronson hospitals. They provide support and work with patients to help them understand their diagnosis and treatment options. They also help with timely access to appointments, offer education and support before and after surgery, help find solutions to personal needs and concerns such as transportation, finances, cosmetic services, nutrition, genetic counseling. The nurse navigator also helps patients coordinate with follow-up treatment programs at Bronson Battle Creek Cancer Care Center and West Michigan Cancer Center in Kalamazoo, and to connect with resources within the community like the American Cancer Society. So basically, they help them through what can be an overwhelming and confusing process.
How can people find out more about getting a mammogram and other breast health services?
They can find additional information on mammograms, mammogram locations, how to make appointments, even patient stories on our website, bronsonhealth.com/mammogram. Patients can also schedule their mammograms quickly and easily online through their Bronson MyChart account.
bronsonhealth.com/mammogram. Doctor, thank you so much. Very valuable and important information. We'll podcast this as well on our website, WCSY.com.
Thank you for having me, Paul.
Thank
Have a
you
good
so
day.
much.